Hi everyone, my name is Wayne Thomas and I'm the Head of Service Performance and Communications for South Wales Fire and Rescue Service, and today I'll be presenting with John Carter, who's our Planning, Performance and Risk Manager, and we'll be giving you a brief overview of our award submission. Our award submission is centred around data visualisation, driving effective decision making throughout our COVID-19 pandemic. I'll start by giving you a very brief overview then of our organisation. So South Wales Fire and Rescue Service is one of the largest fire and rescue services in the UK, covering 10 unitary authorities across a geographical area of approximately 1,100 square miles. We currently have 1,714 members of staff. 792 of these are full-time firefighters, 575 are on-call firefighters, 303 are members of support staff, and 44 are control room staff. And they deliver their functions across the 51 working locations that are broadly distributed throughout our service area. It's also important to note that during the COVID-19 pandemic, the incident has been managed at strategic level by our critical incident team. And during the initial months, daily operations were managed by an operational resilience cell. I'll move on now to give you a very brief project overview. So the COVID-19 pandemic presented a number of risks to the effectiveness of our service delivery, particularly in terms of the availability of our critical staff and the unprecedented increased demand for personal protective equipment. Our performance management team was tasked with creating a number of innovative and intuitive performance dashboards within our organisation's business management information system on behalf of our organisation's critical incident team and the operational resilience cell to facilitate evidence-based decision making as part of the organisation's ongoing response to the COVID-19 pandemic. I'll now hand you over to John Carter, who'll give you a bit more of an in-depth overview of how this was achieved, some of the challenges that they had to overcome, and then some of the dashboards that were created as a result of this project.
Thank you, Wayne. As Wayne mentioned, there was a number of challenges the organisation faced in terms of getting information out to various users across the organisation. Some of that information was available already in existing databases, which we were able to connect to our management information system. There were other data sources that were locally stored on Excel databases, Excel spreadsheets that we had to find ways of linking to our management information system. And we also had to come up with new ways of collecting data, which would be critical for us to be able to track compliance across the organisation during these challenging times. We collated this information into a CIT dashboard, so a critical incident team dashboard, which we made available to the organisation via our business management information system. As you can see here, we made a tile on our BMIS dashboard, which allowed ease of access to senior managers and all relevant members of the CIT working group. The dashboard then contained what we would call key information, one being absence rates. There was no bigger challenge at the start of the year than tracking how many people were absent at a particular time or were isolating for whatever reasons. What we needed to do was to be able to free up the time of the absence management team in order to sort of handle those absences rather than having to handle the requests of each manager or requesting information about how many people are absent at any particular time. So what we did was we linked directly to our HR reporting systems and were able to produce simple to use dashboards, which allowed self-service almost performance information around amount of absence. As you can see here, I can filter that absence by COVID-related absence or other sickness-related absence to have a quick comparison between the two. And I can also look at all absence over time as well. Again, one of these regular questions the team were receiving at that point was how many people were off work at any particular time. What this table did and this dashboard allowed you to do was to almost answer that question yourself in advance of you speaking to absence management. So really adding value to the requests that were coming into the team. And there was multiple filters you could apply, and you could also look back over a different month or over different periods of times. So almost self-service performance information is what we were trying to enact across the organisation. Other challenges that came in were such as regular reporting requirements. So for one example, the NFCC required every single day to be reported the number of absences we were experiencing across the organisation. This would have taken a member of staff a morning to complete each day, and meant that they were unable then to offer support in terms of other activities. So what we were able to do was to produce a simple widget on a page which allowed whoever needed to provide that information to NFCC to go in and extract the relevant information they needed, take it into Excel, and was then able then to share that with relevant parties. So simplifying ad hoc reporting, simplifying standardized reporting was one of the key benefits we found of centralizing all our reporting data into BMIS. Other benefits we were able to find were our ability to understand where our staff actually were living and what parts of the community they were from. In Wales, we were experiencing local restrictions being put in place. These were authority-based restrictions in the mid part of the pandemic. And one of the challenges to the organisation was understanding from a resilience point of view is where our employees were living and what restrictions they may be subject to. So having a quick visual dashboard allowed managers to go in, have a look at particular authorities, and able to drill down into which departments actually had the majority of staff living from a particular area. Again, provided a bit of assurance to our management team that if a change had been made in a restriction level within a certain authority, we already knew then how many members of staff would be affected by that change. Other things we've been able to do with the system is to also bring national data into that system. So Public Health Wales weekly publish the number of cases of COVID and also the number of tests that have been completed and the positive proportion of those tests. We think that's really useful information for our management team to have at their hands. So we brought this into the system as well. As you can see here, you're able to sort of look at each authority for the reporting week, the relevant figures for those authorities. And as we come down the page, you can also see a tracker over the past number of weeks of how many cases have been reported. And you're also then to use some simple widgets to filter that by whichever authority you need to. So really, again, putting information in the hands of the management team in order then to make decisions. Another challenge in the early part of the pandemic was to understand how many incidents we were attending. There was a train of thought in the first months of the pandemic was with more people living at home, we might be experiencing more accidental dwelling fires. So what we did is we provided a simple dashboard that allowed managers to track day by day how many incidents we've been attending, compare that to the previous year, and just give you a general assurance level that incident rates weren't going higher than we were expecting, which means when it comes to operational assurance or operational resilience, we know exactly how many incidents we would usually attend and compare that to our staffing levels to ensure that we can still continue to provide the service we need to the public. Other benefits, we've been able to track our COVID compliance across the organisation using the system. So what we've done is we've created 6 reporting categories of COVID compliance and ask our managers each month to make an assessment on whether they feel compliance is being achieved in each of those areas. So as you can see on this dashboard here, we've got the 6 pillars of COVID compliance, and we are able then to make a top level assessment that compliance is being achieved in each area, and if it's not, we can actually then go into each of those specific areas and highlight the relevant parts or the areas we think are of concern. We've also been able to add existing data into the dashboard. So this one, for example, looks at the number of door swipes on our headquarters building. So this is able then to track the amount of people who are in the headquarters at any particular time. This gives assurance again to management that the changes they are making to the number of personnel that are permissible to come into the building at any point in time is being adhered to. So again, putting information in the hands of our managers so they can not only make decisions, but assess whether the decisions they are making are being followed. And finally, another innovation we've managed to achieve was to use a survey system that we had in place in the organisation to develop a PPE tracker. So this looked at particular types of PPE that were critical to our station's abilities to carry out their functions in the early parts of the pandemic. And we were able to track the number of stocks on those stations and provide a top-level report to our managers highlighting areas where there were lack of PPE available in order for them to make decisions on purchasing or procurement or look at any supply chain issues.
Thank you, John. I'll just end now with some key level outcomes, or key high level outcomes, sorry, that we were able to realise as a direct result of this project. The main one then, and the first one, was that a critical incident team has been provided with unparalleled insight and dynamic information. Vital decisions have been made with significant confidence throughout the ongoing COVID-19 pandemic. The reason that one is so important as well is obviously with the ever-changing picture, newer and newer emerging risks. We've been able to not only provide information to the critical incident team, but provide it in a dynamic nature where even if decisions are made or new risks are identified, we can obviously monitor those risks in real time and make the required changes. Second outcome is that all 51 of our working locations have remained open for business throughout the duration of the pandemic, and we have continued to recruit staff and deliver key elements of operational training throughout. A lot of our communication is focused around being here for you or here for our public. And just know we've been able to do that and been able to monitor that situation in real time has provided us reassurance as well that that message is valid. The third one is that PPE levels have been allocated based on need. This has provided assurance to site managers and has facilitated effective communication. What I mean by that obviously is we've given site managers a way of communicating back in using data that if they've got low levels of PPE, that they will be replenished. So it's given them that confidence that if they are experiencing low levels of certain PPE, that issue is being picked up centrally, and that issue then will be mitigated. The fourth one is members of staff were trained to provide resilience to other departments throughout the pandemic, a need which was identified as a direct result of monitoring departmental absence data via this initiative. And that's something we've been able to do. Like I said, a lot of staff have been upskilled, a lot of training has been provided, based on us just being able to keep an eye out on where those key areas of sickness will impact the business. Again, so a lot of staff have been upskilled and trained as a direct result of us identifying risks, but being able to do it long before those risks have caused us any business problems. And finally, this working example of using innovative information to make evidence-based decisions as required has ignited the organisation's passion for data. I think it's safe to say, because they're making these decisions and having such confidence in making decisions in real time, has led to a lot of other requests for information coming in order to facilitate other decisions. And it's safe to say there are even some examples of where information that we've used as part of this project has now been used to make other decisions that were initially out of scope. So again, has really changed the way we look at data, certainly improved the way we look at data as an organisation. But again, thank you very much for your time today.